Hi, my name is Dr. Christopher Scott. I'm a psychologist practicing in the Houston area. I'm a certified Gottman couples therapist. Also, I'm a certified sex therapist. And today I'm going to talk about tips for your first individual therapy visit. So first off, what should you expect in that first visit? Well, first of all is that your therapist is probably going to start off by going over just a few basic policies and procedures, such as like cancellation policies, confidentiality, those sorts of things. It's great if you have questions for those, but oftentimes that's going to be a pretty short component of the visit. Most of the first visit is going to be focused on your goals for therapy and your presenting concerns, and also your history. In my practice, I typically do a pretty thorough individual history over the first and second visit, but each therapist is a little bit different. So this goes to my first tip here, is that before that first visit, what I suggest is take some notes on your goals for therapy. And it's going to be very tempting to focus on goals about things that you don't have a lot of control over. But I really recommend focusing on goals such as like changing how you look at things or changing your thought processes about things. Being able to change your behavior or your communication, or how you engage in self-care. These are all things that you have complete control over. With some help from your therapist, you can find ways to do that. And it's going to feel much more effective for you than focusing on things that are outside of your control. Also, when you're taking notes, you might want to take some notes about your developmental history. For instance, if you've had any previous diagnosis of like learning disabilities or chronic medical conditions, those are going to be really helpful to talk about in that first session. Also related to that is any previous therapy that you've done. What worked and what didn't work in those therapy sessions? So this goes to my second tip here. I would suggest that when you get set up for this first session, if it's going to be in person, make sure that you're trying to arrive a little bit early so you can find the location. Oftentimes people are a little stressed out for that first session, and it's a good idea to try to get there a little bit early for that. Now, more and more sessions are being done via telehealth, and it's a great option for people. It makes therapy much more accessible. So for that first telehealth visit, what I really recommend are a few things. One, make sure you've got a really good internet connection. That means typically having a good Wi-Fi connection or a hardwired connection. So try to avoid being on your phone in a kind of distant or rural location. Those places are going to get not so great connections, and your session will be maybe a bit diminished. This runs into a few other tips I have about telehealth visits. Is try to use the biggest device you can. Typically that's a desktop computer or a laptop. A tablet will work in a pinch, but the smaller you get with the screen, that gives you some serious limitations. A lot of therapists nowadays, including myself, we like to use a lot of shared screen technology to show resources, or we might even do some collaborative work together around goal setting using like a whiteboard or other techniques. Those are going to be really difficult to do on a small screen, and if you don't have access to like a keyboard and a mouse. Can you make it work? Yes, but you're going to have some serious limitations. So I do recommend using the biggest device you can for your therapy sessions. Also, you want to have a private location, so there won't be other people around, nor will there be a lot of interruptions. You want to be able to talk freely. This is leading to one other part here is please make sure that if you have to, for instance, drive away from your office and have your session using your phone in your vehicle, that you make sure your vehicle is in a safe space and it's not moving. My personal policy is that I don't do any sessions if a person's in a moving vehicle. That's just for safety reasons. So these are some important parts with getting set up. But this leads to our next recommendation, and that is to bring some sort of therapy journal with you where you can take down ideas that come up in your sessions. You can write down your goals that you work on collaboratively with your therapist, as well as homework assignments or ideas of things that you want to communicate with other people between visits. I oftentimes recommend something really simple, just like a paper notebook. That's perfect. A tablet will work sometimes. A phone, not so great. A lot of people really struggle to type out notes on their phone in a situation like a therapy session. So I would say ditch the phone, just bring a basic paper notebook that you can use as your therapy journal. And also can serve as a place you can put any like paper handouts your therapist gives you during the process. Now we got to my last tip. And the last tip is that after your first visit, make sure to fill out any exit forms or assessments that your therapist has given you for your therapy session. In my practice, I'll typically give assessments after each visit. And so please complete those. Those are really helpful for measuring progress and also getting feedback to your therapist. Also, during this process, write down any personal goals between visits or homework assignments you talked about with your therapist to help remind yourself. So those are some of my tips for your first therapy visit. Thank you for joining me today. If you want to connect, you can reach me at drchristopherscott@gmail.com or my website at scottpsychologicalservices.org. Thanks for joining me today.